and that just gives you a snapshot of that information basically that I've given you around the ingredients.
Sorry, and this there's the curcumin result. So I see. I'm just trying to make out. So the one that we're talking about is the one at the top. Is it on that chart? Is this the curcumin?
This one here, is this?
Yeah.
Yeah, so it's this, sorry, it's the Acumen. It's this one here is the one that that we're using. So that one there.
Okay. Okay. So like it's quite outperforming the Mariva style.
Yeah, Mariva, and then the volatile oil formulation is the BCM 95.
Right. Okay.
So it was shown to have almost 1.8 times the bioavailability or the absorption of Mariva. And nearly 5 times the absorption of the BCM 95. So it's significantly in these absorption studies, and this is over a 24-hour period, so you can see there the peak in about 4 hours, but then maintaining that elevated level. Yeah, so you can see there really high bioavailability and absorption with this technology.
That's great. That's great.
Yeah.
So we were kind of looking for the next best, you know, the next format, and so we're glad to see this because you know, we could switch some brand we have at the moment to this.
We do.
Obviously, you've got the curcumin in the, you know, Soul capsule. That's what I'm referring to. Yeah.
So this is the Curcuma Clinical, is the one that is just this Acumen on its own.
Right. Okay.
Because we do have two, because we do have the Mariva as well, which is curcuminoid ultra pure, which we've had for a few years now, and now we do have this one we've brought out on its own, which is the Curcuma Clinical.
Curcumin Clinical. Okay. So just make note of this then, because we would switch out of the VN one to this. Yeah. And probably we've been using the Bioceuticals Theracumin as well. So, you know, which was also outperforming Mariva. Have those two been head to head, the Theracumin and this Acumen?
I haven't seen a head to head with that as far as with these particular studies. Yeah, but we're getting exceptionally good results with the Curcuma Clinical. We are getting really good therapeutic results. Yeah,
well, I think the one change I see between the other and that is the Theracumin's really about 12-hour activity again, like these others, whereas this is quite extended. So it would suit people to take a once-a-day dose, if, you know, in most cases.
Yes, exactly. So certainly indications are you could potentially prescribe one a day. Yeah. Sometimes 2, but often 1 a day is sufficient because of that high bioavailability and absorption. If you do like anti-inflammatory combinations, Synergesic is excellent, and that has this particular turmeric together with Boswellia, Withania, Jamaican dogwood and ginger, all in really good doses. So if you're wanting a combination, that's a good one to have a look at, but otherwise the Curcuma Clinical, just the turmeric on its own.
Just while we're touching on that, I don't know if you're planning to go to curcumin today or not, but that last one you just mentioned, sorry, Synergistic, was it?
Yeah, look, let me just quickly bring it up. That's happy to do that. Synergesic, which if you're wanting a combination, was launched this year, I think July, or maybe anyway, sometime this year. It's also going really well because it's working well therapeutically. A very nice combination of anti-inflammatory herbs. So Boswellia and a high boswellic acid Boswellia extract together with this turmeric. So the total curcuminoids, I think, is 58 or 59 milligrams. Oh, here we go. Sorry, 59 milligrams of total curcuminoids with Withania, which is actually anti-inflammatory, as well as all the other benefits that we know of Withania. 1 gram of ginger, so a good dose of ginger, and also 1 gram of Jamaican dogwood, or the Pisidia piscopula. So also particularly beneficial for chronic pain that's associated with fatigue and poor sleep. And we do know that they do go hand in hand. There's a high incidence of fatigue, high incidence of poor sleep in those with chronic pain. And actually poor sleep increases pain perception. So it's not so much that pain is interfering with people's sleep, which certainly can be the case. But if people aren't sleeping well, that's actually increasing their pain perception and worsening their chronic pain conditions.
Yeah, that looks like a good formula, and it's been taken up pretty well by the active practitioners, has it?
Very well. It's been going extremely, extremely well. We launched, I think, around the middle of the year, maybe May or June. And it's going really well therapeutically. So a particularly good one, as I mentioned, to prescribe at night if people aren't sleeping very well, because it will improve sleep as well as pain and inflammation.
And I heard whether practitioners are switching from the curcumin product we were just covering to this. Are they switching if they're using it for pain management?
It's a very good question. And so I'm just trying to think which one would be used. I do think in most instances, I guess it depends on what practitioners are treating, but I think predominantly using the combination, unless there's a particular reason why you're not wanting the combination of anti-inflammatories and just wanting to use turmeric on its own. This is certainly proving to be a more popular option.
Yeah, it might be with some of those IL-6 autoimmune diseases. The other one would be more targeted for that, but that's getting a bit technical.
Yeah, or if it's for cancer management, etc., they may sometimes use just the straight high-dose curcumin. But yeah, no, I think generally for pain and inflammation, synergesic.
Yeah, it looks to be quite good. So glad to hear that the uptake is good.
Yeah, it's been excellent. So were there any questions around GutRx, or was that fairly straightforward?
No, it's pretty straightforward. And like you say, it's distinguished by a high dose of glutamine. And actually the quercetin level's nice and satisfactory too, because to Gina, this issue of inflammatory, histamine-related inflammation in the gut is a big deal. In fact, one of the better things for helping with leaky gut is quercetin. It's a bit of a hidden one on that, but I mean, slightly high doses than this, but it's quite a good healing agent in terms of, swollen, irritated tissues, which is essentially what the leaky gut is. It's a way of managing those types of issues. So this is a pretty good product. It's doing the repair, but it's also doing the healing. I mean, doing the anti-inflammatory, but it's also doing the repair quite nicely.
Yeah, and the doses were chosen specifically to reflect the research. So there are studies, as you mentioned, you may go higher with quercetin, but there are studies at 500 milligrams, which reflects the 2 serves. So we just, they did make sure that at, 1 or 2, at 2 serves particularly, we were covering published research in each of the ingredients.
Yeah, it looks good. So yeah, we'll be moving more of that. We've got similar products like a DFH one, but this looks to be clinically more appropriate.
Yeah.
Yeah. Good. We can move on, I think.
Okay. So the next one was Pure Children's Essentials, which probably doesn't need a lot of explanation, but we'll just go through the ingredients just so you're familiar with it, as being a new product to you. I guess one of the key things with this formula is that it is unflavoured. Now we may... It has very little taste, and it's... Oh, that's okay, sorry, I'll just go use a different option. I'll just... stop screen sharing for a moment. Okay, there it is. So the Pure Children's Essentials, as the name suggests, it's a children's multivitamin. It's in a powdered form, so 225 grams at half a scoop per day, and all these doses do reflect a half scoop. It's providing 50 doses, so it's quite economical. The doses have been designed around this 4 to 8 year age group, particularly. So reflecting that half a scoop, but certainly because it's a powder, you can titrate the dose, so down to 1/3 of a scoop for younger children, and for older children 9 to 13 at 1 scoop a day. I think what is really stands out with this formula is that it is a relatively new formula. It's only been out for maybe a couple of years. So it does have all of the more up-to-date ingredients. As opposed to other children's multis, particularly here in the Australian market, that haven't really been updated in recent times. So they still have, you know, some folic acid, cyanocobalamin, and they may not contain some of these key ingredients. So it really does provide a good foundational multivitamin nutritional support, particularly suitable for children that are fussy eaters, which is most children, or children that have allergies, and so they're on a restricted diet and then can be missing out on some of these key nutrients. We do have minerals in citrate forms and a very good dose of calcium and magnesium. So per half scoop, 250 milligrams of calcium citrate, 130 of magnesium citrate, some vitamin D, both K1 and K2, a little bit of choline and iodine for brain development, some iron, vitamin C, vitamin A, 6 milligrams of zinc citrate, some selenium, vitamin E, all of the B vitamins, including activated forms. So we have P5P, activated riboflavin, hydroxocobalamin and methylcobalamin, folinic acid in this particular formula, and then a little bit of chromium, magnesium, molybdenum, potassium citrate, some lysine, which is important for immune development, and 2 grams of glycine. So that's really added as a sweetener. So there's no other sweeteners or flavorings in the formula. So we did want it to be a hypoallergenic formulation, that it is suitable for all children. Because of that, we did actually, I didn't bring that up, but I can send it through to you. We did put together a dosing sheet because of course compliance is important when we're supplementing children. So it does mix really well with pear juice or some diluted pear juice. Otherwise, the recommendation is to put it in a smoothie for kids. And then you really, when I've tasted it, it has very little flavor. It's very bland. I did actually, it may be worth mentioning, in my experience, if I tried it, tasted it after eating, I really couldn't taste anything. On an empty stomach or a clean palate, you could taste the minerals a little bit, taste it a little bit. You can taste the minerals, but not a huge amount of flavor. But of course, you know, children have a different taste perception. So I would recommend mixing it in a small amount of whatever juice is appropriate for that child, so diluted juice or into a smoothie. But the glycine, apart from providing a natural sweetener without the use of other sweeteners, it also is calming. So it acts as an inhibitory neurotransmitter, can increase GABA, and can improve sleep as well at night for children. But it's actually really calming. So if you have children that have a little bit of ADHD or behavioural issues, it can have that calming effect.
Yeah,
but otherwise,
the glycine effect for night was my secret ingredient for a better night's sleep. Took me a long time to find it. You know, it's got gosh, it's gone. The glutamine system that is more stimulating. Yeah, sorry, I've just kind of gone a bit fuzzy there. But it has worked out very well for me.
Yeah, good one to keep in mind. We do glycine on its own as well, and it's in some other formulas. It's often listed as an excipient as well, but it reduces salicylate sensitivity, improves sleep. You know, it can help with anxiety. It's calming, but maintains that clarity and focus.
Oh, I hadn't heard.
But yeah, good one to add.
That's interesting. I hadn't heard that it helped salicylate sensitivity. That's quite handy at times.
Yeah.
Which ingredient was that?
So a lot of the ADHD children salicylate sensitive, and the same with autistic children. It's not every one of them, but it's a high proportion, so it's maybe 60%. So that's in their children's formula is a good thing. You know, that's nice to see. It'd be quite a good formula for the type of children.
And that's why I think that's why they recommended pear juice as well, because if I'm not mistaken, it's low salicylate, the pear juice.
Yeah, I think you're right there.
So it's kind of, and they wanted to make sure it had as few additives as possible, again, for that reason, so that, you know, even children with sensitivities.
Louisa.
Sorry, Jean, I didn't quite get that.
Didn't quite hear that.
Can you hear that, Graham? Or?
No, it's missing me too.
Can you point to the ingredients? We're not quite sure which one we're talking about.
Oh, glycine. Sorry, glycine.
Glycine, the last ingredient is it's a sweet taste. Actually, 2 grams of glycine for a child is, well, it would be half. Okay, that's a half scoop. That's quite a high dose, so it definitely have effect. You know, for adults, you can go to say 4 grams for this sleep effect, but that's going to definitely be slightly calming.
Yeah, and it supports liver detoxification as well. I mean, glycine has so many benefits. But interestingly, one of its mechanisms for sleep, and particularly for adults, is that it actually has a cooling or a thermogenic effect. It increases vasodilation and heat dissipation. And we need our core body temperature to be low in order to have good quality sleep. So that's sort of one of the mechanisms whereby it's improving sleep quality.
Could you also talk about the lysine in the formula?
So the lysine is important for immune system, but I do believe that it also helps with appetite with children.
It's often put in the appetite formulas, yeah.
Yeah, it is, yeah. So I believe it has an effect on appetite for children, but also it's important for immune system function as well.
Yeah, and just the other feature in the product that I noticed is the choline level is unusually high. It's a very up-to-date formula in that sense. Choline's often hardly even added to formulas, and certainly not in kids' multis, whereas it's actually quite helpful for brain development. Yeah, so you know, potentially this is a decent formula for pregnant women, actually. Their choline is necessary during their pregnancy, and it gives them a bit of iron and so on. So anybody not looking for a very high folate dose, just an adequate one, you know, they could use the full scoop to get their 400 of their folinate. So yeah, it would be a doable formula for pregnant mums, but you know, if they want a powder.
Yeah. And they'll actually, you know, on that note, they'll be getting a nice dose of calcium magnesium as well as all the other nutrients.
Yeah.
I mean, we do have, you know, the
vitamin A, that it'd raise a bit of concern, but it's still very safe, even at if you're doing a full dose for them, 2,600. But it is safe at that, you know, well under the worry level. So although it might raise some concern to sell it to them, you know, I'm only mentioning it that it's not a bad formula because of the high choline for pregnancy.
Yeah. Yeah, absolutely. Could be a good alternative to say the pure natal if they don't want to take a capsule.
Yeah.
Absolutely. So let me just see if this is working. So the next one I was going to cover, if this doesn't work, I'll just pull it up the other way. Is the zinc and C lozenges, which I think is one. The zinc and C and clinical C, I think you ordered a fair bit of, so that's something that you may use.
Yeah.
No, it's okay. I'll just do it this way. Sorry, excuse me. So the zinc and C lozenges, they are chewable. Of course, you could swallow them, but they are chewable tablets. and it contains zinc gluconate. And this particular form of gluconate, so a total of 7 milligrams of zinc per tablet, comes in 100 tablets. So this particular form of zinc it has a topical bacterial antiviral effect on the throat, which is why that particular zinc has been used. Also 100 milligrams of vitamin C and ascorbic acid, as well as some sodium ascorbate. A little bit of magnesium. It is an older formula, so it has magnesium oxide, but it's only a smaller amount. And then vitamin A, so 1000 IU of vitamin A again per tablet, and a little bit of lysine. And as I mentioned, lysine is also important for immune system function. So being great for sore throats, but also a good one to have. I like to have this one on hand if I'm moving around, if I'm out and about during the day for work, or if I'm traveling and I've either got a cold or feel like I've got a sore throat and fighting a cold. Being a tablet, it's an easy one just to take quite regularly. And of course, you can dose up. It's only 7 milligrams per tablet, so you can take it quite frequently. Sometimes I just do take 2 tablets, maybe 3 or 4 times a day, or as required, to help with sore throats, colds, flus, etc. But also the vitamin.
Just on that one, Louisa, on your success rate of heading off a cold when I understand that traveling thing and often get the similar symptom, well, when I'm traveling.
Yeah.
Do you find that's like 100% good in terms of managing that symptom, or do you find that you need the extra vitamin C or something else on top?
Look, if I was at home and I had access to everything, I would, so how many would I take? I'd take probably up to 8 a day, which would give 900 milligrams of vitamin C. If I was at home, I might dose up with a little bit of extra vitamin C powder at night before I went to bed. But in saying that, when I'm traveling or if I'm away and this is what I have, and I dose up, like I said, quite high, maybe 3 or 4 times a day, it usually is sufficient at that first sign of a tingle, of a sore throat, or just making sure I'm taking it on a daily basis. It usually will eliminate it. It will usually prevent it progressing. I think the key thing with those sorts of things is getting right at the first sign of a sore throat, is just really getting on top of it really early. If you can do that within the first 12 to 24 hours, or really the first 12 hours, then that's where you get the best outcomes.
Understood.
Yeah. Another application here that is worth mentioning is for acne. Because of the vitamin A, of course, as well as the zinc and vitamin C, this can be really beneficial for young people or older people, but young people experiencing acne, to help reduce the inflammation, really speed up the tissue repair, tissue healing, and prevent scarring.
Mm-hmm.
So another application there.
Mm-hmm.
So probably don't need to go into too much more detail about that one. Unless there are any questions at all. If somebody really didn't like the taste, they could just swallow it. However, just bear in mind, with the zinc gluconate, you do have a topical antibacterial effect. So I actually don't mind the taste. They're not very sweet, but we tend not to make our products super sweet. So they're just like a vitamin C, a little bit tangy, and citrusy. So has a sort of a lemon and orange flavour. They are quite hard. I just usually, you can, dissolve it slowly in your mouth. I often just chew them, and I find it works quite well just chewing it. So the clinical C was the next one, which is vitamin C in a tablet form. So this is 1000 milligrams of vitamin C in a tablet in low acid formulas, so in buffered forms. So 600 milligrams of elemental vitamin C in calcium ascorbate and 400 milligrams of vitamin C in the sodium ascorbate form. And I think what makes this one unique is it does have quite a unique combination of cofactors together with the vitamin C, but also the dose of 1000 milligrams really makes it easy to reflect research of, between 1 and 2 grams or even higher of vitamin C. Important for immune system, of course, blood sugar regulation, so vitamin C deficiency is certainly associated with diabetes. Our brains have a very high concentration of vitamin C, and it is important for neurotransmitter modulation and function, and of course for our adrenals as well. And then the cofactors are glutathione, bioflavonoids, so rutin and hesperidin for blood vessel integrity, some alpha-lipoic acid, selenium, B3, B6, and vitamin E. So as I think we touched on last time, it contains all of the cofactors to help recycle and regenerate vitamin C and keep it in the system longer. So we know vitamin C regenerates vitamin E and vice versa. Alpha-lipoic acid regenerates both glutathione and vitamin C. And the selenium and B6 are required to regenerate glutathione. So alpha-lipoic acid particularly is really important addition to this formula. Because glutathione is the rate limiting step there, alpha-lipoic acid helps to regenerate both glutathione and vitamin C. So not only keeping vitamin C particularly in the system longer, but also, you know, preventing these antioxidants becoming, you know, free radicals in their own right. So basically getting a better therapeutic effect because you have these specific cofactors included.
Yeah, and now just where that particularly comes in handy is in at the point when bacteria are getting into the system and you start to see the lymph nodes coming up and people developing a fever. It's also somewhat relevant for viruses, but there's a defense system that kicks in on usually the second day of an infection through to about day 6. In the innate immune system, the macrophages mainly, and they start to require very high doses of vitamin C at that time. Basically because they're producing a lot of reactive oxygen species to burn off some of the infection. And within the macrophages, they run short of the other antioxidants like vitamin E, selenium, glutathione. And so with this one, you know, you wouldn't probably need to go to quite such a high dosage as some people have to when they take vitamin C during that second, you know, once they know they've got an infection past the sore throat and when the glands in the throat are swelling up or whatever. So, you know, many times you go to 6 or 8 grams of vitamin C during that phase of an infection when you know, a vitamin C friendly practitioner. But I wouldn't be surprised this would do just as well a half the dose, which is what patients are willing to take. So, you know, 3 times a day to probably do the trick of twice that because of its recycling capacity. So basically the message there was during the sort of phase of infection, you know, just briefly, the vitamin D and probiotics and that zinc product are super to protect you from infection or in the first days of infection. Hopefully you've got the vitamin D in your system and the probiotics, but the zinc is the one you can start. But this would be the one that, let's say, it just seems to get past your initial defenses. And then you get into these high doses of vitamin C for that sort of day 2 to day 6 stage, where if you can stop it there, you tend to prevent the more difficult stage of infection when it goes down into the chest and so on. So yeah, I think it'd be potentially a lighter dose in that stage. And generally people don't like to take 8 grams of something. They just kind of get frightened of it. So, you know, 3 times a day with their meals, no worries. Or on an empty stomach, it's neutral, so it should be good.
Yeah. And convenience of a tablet, they can take it to work with them or if they're out and about. Yeah, and quite easy to take these tablets as well.
Yeah, nice.
Yeah. So the vitamin E synergy was the next one that I was going to cover. What do you, this is obviously something you go through, prescribe quite a lot too. What would you prescribe this predominantly for vitamin E on its own?
Well, I'm very big on the tocotrienols. You know, I think the general quote is that it's about 50 times more active in the cell membranes, particularly the regulation of those. And I've had a pretty decent look at the whole problem with mitochondria. and all of those membranes within the mitochondria, and how they get damaged even by that sort of stage of infection we were talking about, when the viruses go in and stay there like a mono or something like that. So very often with high toxicity, the mitochondria need protection. Here in Hong Kong, we have a lot of mold through the summer. And so we get actually a fairly high a number of patients coming in for mold toxicity, and quite apart from, clearing the mold from their home and draining it out of their bowel with whatever, chelating agents is appropriate for the mold. You've got to protect the mitochondria because, these patients have become quite fatigued and they've gone into a stage called the cell danger response, where they're protecting themselves. Now that last product, the vitamin C product, is quite handy for the same process. And complementary with that is this vitamin E synergy. So this is a nice dose. I'd be using this up to 3 times a day, but it's a nice, basically because of the fat soluble factor in the tocotrienols. You're getting quite a lot of protection of the membranes. So that's its forte, and it particularly comes up handy when people are getting fatigue from either long-term viruses or long-term or fairly high exposure to toxins. So it's able to help regenerate the mitochondria. It's a pretty important part of it. The membranes in those get damaged by the free radical damage.
Absolutely. So really important antioxidant, as you said, and also for all the cell membranes for immune system, etc. As you mentioned, it has the important tocotrienols in there. So it does have the full 8 isomers of tocopherols and tocotrienols. Some of the negative press in the past around vitamin E has been because a lot of the research was conducted on alpha tocopherol on its own. So just one of the isomers, whereas there are 8 isomers in total, 4 tocopherols and 4 tocotrienols. And as you mentioned, the tocotrienols do have a different structure, and they do have an unsaturated side chain, allowing that penetration into tissues such as the cell membranes, but also the brain and the liver, etc. And also the tocotrienols have some really strong research for cancer prevention and also for protection against neurodegenerative conditions. Having those natural isomers, having it in its natural state, it is sustainably sourced as well, which is important. It does have the cofactors in there as well that, as we mentioned previously with the clinical C. But some of the, you've already mentioned some of the benefits of the tocotrienols, but some of the other clinical applications are for helping to maintain healthy cholesterol levels, really important for cardiovascular health to protect against atherosclerosis, as well as reducing arterial stiffness and platelet aggregation, protecting against neurodegenerative conditions like Alzheimer's, etc., and the effects of stroke. So anything to do with the brain, really important. And also alpha tocotrienol is much, much more potent than alpha tocopherol as an antioxidant, and particularly in the prevention of lipid peroxidation, and also really important for treatment of conditions like non-alcoholic fatty liver disease. Yeah, absolutely, because of that
process.
Yeah, absolutely. So yeah, like I mentioned, a lot of the research initially done on alpha tocopherol, proved to be somewhat problematic, but we really need all of these 8 isomers. And also, interestingly, the gamma tocopherol is extremely important, and high dose of alpha tocopherol on its own, which was historically, utilized and supplemented in research, can displace the gamma tocopherol. So having too much of one of the isomers, the alpha, displacing the gamma tocopherol. And the gamma tocopherol is a very powerful anti-inflammatory. It improves endothelial function by increasing nitric oxide synthase. and also inhibiting cancer cell growth, particularly colon cancers and also prostate cancer. So we now know the importance of, you know, things like gamma tocopherol as well as the tocotrienols as having, you know, important therapeutic benefit, and also being a fat-soluble vitamin, not as easy to get through the diet and more likely to be deficient, you know, poor intake or poor absorption of fat-soluble vitamins.
Yeah, I don't know if this product, I just mentioned something. I don't know if this product will achieve it, but there was just one study done on the tocotrienols and asthma. And it was actually an animal, I think it was mice experiment. But I transferred it into clinical use, and I found one of the better things actually to manage asthma. You know, you might use vitamin C and quercetin or something like that, but as well for the allergic asthma. But this one goes into balancing that, you know, Louisa, you know, the Th2 to Th1 balance. It's pretty good at correcting that type of imbalance. And so it helps with restoring the immune system out of being allergic pretty well, actually. I've been fairly impressed with it. But I'm able to give, just for your information, Louisa, you know, 300 milligrams. And at that dose, it normally works, and unless somebody's got, you know, more of a mast syndrome type of thing. But it's effective for asthma, the short answer.
Right. 2 capsules a day equivalent, what are you saying? So around that? 3.
Yeah, I'll be using at least 2. At least 2, but because it's synergistic again, you might find the 2 is equivalent to a high dose of the pure tocotrienols.
Yeah. Yeah, thank you. Heme Synergy was the next one that we were going through, which is, yes, an iron supplement, but also with an interesting combination of cofactors again. So it does contain 24 milligrams of iron diglycinate, so in a well-absorbed form, together with vitamin C, as we know, important for absorption of iron. And then we have vitamin A, so 2,500 IU of vitamin A, and I'll just go through why that's important. Together with all of the Bs, so full B complex in activated Bs, a higher amount of B12, so 200 of methylcobalamin and 200 of hydroxo, so a total of 400 micrograms of B12, 100 of methylcobalamin and 100 of folinic acid, so combined 200 micrograms of folate, as I mentioned, together with P5P, all of the Bs. So I guess a couple of things that you may or may not be familiar with is that vitamin A is actually key to not only absorption of iron across the mucosa, but also for mobilizing stored iron from ferritin. So there's actually a study, it's on the back of this sheet, where they supplemented a group of preschool children with 360 micrograms of vitamin A for 6 months. And they actually found an increase in their serum iron. And this was really via the mobilization of their ferritin stores. So their iron intake remained unchanged, but their serum iron increased and reduced their ferritin concentrations. So really important for helping to mobilize stored iron from ferritin. And likewise, riboflavin, which is not always included as a cofactor. So we often have, you know, folate, B12 and B6 as the key cofactors in an iron supplement. But riboflavin also is involved in mobilizing iron from ferritin and improving the response to iron supplementation. So as a formulation, it's really designed to not only provide some iron support, serum iron levels, and address low iron intake, etc., but also the whole process of erythropoiesis. So improving red blood cell production and heme synthesis, supporting absorption through iron intake, and also helping to mobilise iron from ferritin. So increasing red blood cell production, hemoglobin, and absorption of iron across the mucosa, and mobilising iron from ferritin.
That's great. Nice diagram too. Just throw it in, vitamin A does that similar type of thing for zinc. It helps it absorb, and it helps it to mobilise, and it changes, it's necessary for changing beta carotene into vitamin A. There's a strong zinc and vitamin A connection as well. I'm talking about vitamin A, and here we talk about it here with iron, but it's got a similar type of process that's helping it to work, is the vitamin A.
Yeah.
Back to that lozenge that we were just looking at earlier, that they cofactors as well, like this iron and vitamin A is.
Yeah, and sometimes we just don't think of it in that context of working as cofactors together. And certainly, again, you know, fat-soluble vitamins, sometimes, you know, we're not getting enough from the diet or not absorbing them. So vitamin A particularly can be a relatively common deficiency.
Yeah, vegetarians are funky with it. They've got all this beta carotene, but they don't have enough zinc. So, you know, they often don't actually have a terribly good vitamin A status in the vitamin A form, the retinoic acid.
Yeah, which is important. And look, there is also some evidence, I'm not sure if this is how you prescribe iron supplements, but supplementing every second day instead of every day, particularly, probably more important for people that do have, that are meat eaters, that are eating meat, and particularly red meat on a regular basis. But we do have a hormone called hepcidin that is, I guess, a homeostatic mechanism, because iron can, in high doses, be toxic. So as a way to sort of maintain iron levels, we have hepcidin that causes a mucosal block and blocks the absorption of iron. So if we're having an you know, ongoing intake of iron, our hepcidin can be low, tends to reduce in the morning, so good to supplement iron in the morning. And likewise, evidence does suggest supplementing with iron every second day can be beneficial for some patients. So that allows the hepcidin to come back down, so that supplementing every second day, you have better absorption. So just something else to keep in mind.
I haven't heard that one. That's interesting.
Well, you know, it is interesting, because it came up when we did this training for heme synergy, and I was like, oh wow, that's something new. I didn't know either. And I asked, if it was new research, new information, and you know, I think this research has been around for a long time, but it just wasn't in the forefront of what we were talking about, and I think it's just become apparent in more recent times about this mucosal block. So I thought that was actually quite interesting.
I'll just say something from my team there, and just my own clinical experience on long-term iron supplementation for women. Usually their iron maintains quite nicely on 10 doses a month, and some women choose to do that for the 10 days starting their period, and others every third day. And that maintains, but it doesn't normally get the iron level up fast enough. So you know, you might do it every day for the first month. That's standard what I do in the clinic, depending on their level, a month and even 6 weeks, and then go back to these maintenance doses. For the menstruating women, you know, particularly they need their extra boost during and after their period. So there can be the 10 days you just do in a row. The WHO says to supplement people who are not getting iron in their diet, which, by the way, 96% of people in Hong Kong don't, because they don't eat beef. It's a very, very high deficiency level in Hong Kong, and so it particularly affects the women. That the WHO says 3 times a week, you know, effectively about 10 doses a month for supplementation of iron. They're talking about global populations, WHO, when they're looking at iron's one of the deficiencies across the globe. So it just gives you some idea about this infrequent dosing in the long term rather than daily dosing.
I think it helps with the compliance as well, particularly with iron. I know I struggle to take, you know, just with my own dosing, because you have to take it away from other supplements. So you have your regime where you take everything in the morning. Having to take iron away from other supplements, I think it helps with compliance, you know, just having it like you said, whether it's 3 times a week, 10 times a month, supplementing that way.
Good point.
Does seem to be increasingly, I've noticed with practitioners here in Australia, increasingly a problem, and stubbornly resistant to treatment as well for some reason. So I think having those added cofactors does help as well.
Yeah, we found that you've got a very equivalent product in bioceuticals, which we'll go out of for this, but you know, we found that super, that other,
great.
Other similar formula.
Okay, so NAC is definitely one of my favourite supplements. We do use a pharmaceutical grade NAC. It has a nice, pleasant berry flavour that is nice on its own. It is slightly tart, because NAC is slightly tart or sour, rather than overly sweet. It is sweetened with, does have a little bit of sweetener with stevia and a berry flavour. But also being a berry flavour, it combines well with any of our other powders. So you mix NAC in with any other powder, and that berry flavour does tend to blend quite well. I have a couple of really good tech sheets that I usually use to talk about glutathione, because it gives a really good snapshot of the functions, and we have a great chart as well that goes through the research. There's over 30 years of research on NAC, so it's a highly researched substance. It's also quite safe, and there's no major contraindication. And some of the studies are supplementing NAC alongside medication that can be safely used. So you can see here, I guess, the functions, or some of the key functions of NAC. So certainly it is a precursor for glutathione production, and a lot of its benefits are, you know, down to the benefits of glutathione. But it is an antioxidant in its own right as well, which is what this is referring to. It modulates both dopamine and glutamate, and it also stimulates neurogenesis. So it was shown to stimulate nutrite sprouting, which I think is quite significant as well, because until not very long ago, we didn't think that that was possible. We thought that, you know, we lost neurons as we aged, but we couldn't increase neurogenesis, and we now know that's not the case, which is good. It also modulates the immune system, so inhibits a lot of pro-inflammatory cytokines, including and also NF-kappa B, and also stimulates natural killer cell function and T lymphocytes. So an important supplement for immune modulation. And it's also mucolytic. So it increases mucus breakdown, so it interferes with the protein bonds of the mucus and helps to break it up, and it's mucolytic, and also improves mucociliary clearance. So initially when we started, I mean, we've had that NAC for several years now, but initially one of its applications that I sometimes forgot about was for colds and flus and as a mucolytic, but it has been used historically in hospitals as an inhalation for cystic fibrosis patients. So it is particularly good mucolytic, and a great one to keep in mind for chronic bronchitis, you know, sinus, as well as colds and flus, etc. There was a pilot study, I'm not sure if they've researched this further, but there was a pilot study a few years ago showing that it actually inhibits the influenza virus as well. So a lot of its benefits do come down to these broad functions. When we're talking about glutathione, it is the rate limiting step. So NAC provides the cysteine, 2 cysteine molecules combine to form cysteine. And then cysteine enters the cell at this antiporter system. So one cysteine molecule enters the cell and then gets broken up again into 2 cysteine molecules, combines with glutamate and glycine to produce glutathione. And then at the same time that the cysteine's entering the cell, a glutamate molecule exits the cell. It then binds to a glutamate receptor, inhibiting the further release of glutamate, which is how it actually helps to modulate glutamate. So it may be one of the mechanisms whereby it's helping with autism disorder, which they can have. One of the mechanisms there is elevated high glutamate levels. So the chart outlines some of its clinical applications. I'm not sure how much you're using NAC and what for at the moment, but it really has incredibly broad applications. Certainly for addictions, a few mechanisms there, but one of the main ones is by modulating dopamine. So dopamine is so important for that reward pathway, and addictions highly correlated with dopamine. So when people are partaking in their substance or behaviour, they're really trying to stimulate their dopamine release. So good research supporting its use. There was this, they started some research last year on ice addiction, which is a very big, not hearing about it so much in the last 12 months or so, but it has been a huge problem here in Australia. And I remember hearing on the radio that they had discovered this new drug that they were trialling for ice addiction, and they had some really good results in reducing cravings, etc. And then when I went on to find what it was actually NAC. So great that they're now researching it in that way and discovering it as this great, you know, new drug, so to speak. But, you know, we've known about the benefits of NAC for a little while now. But if that can be, you know, utilised more broadly, then I think that's fantastic. Also for mental health, particularly bipolar, also schizophrenia. There's a hospital in Sydney, the psychiatrists are prescribing our NAC, and I remember one of my colleagues saying that the pharmacist connected to that hospital commented that these patients were coming back asking for their pink powder, and she said that that's actually really remarkable because these patients don't do that. They don't, you know, come back, you know, asking for supplements, but they were feeling, because they were feeling so much better, they were actually coming back and asking for that. So a whole range of different mental health presentations. Also traumatic brain injury is one that I like to highlight. You know, there was a study in Iraq with a group of patients that were subjected to an acute blast injury. They treated within 24 hours. They supplemented with 4 grams a day for 4 days and 3 grams a day of NAC for 3 days. In that 7 day period, the treatment group had an 83% resolution of symptoms. So even though you may not be treating those particular patients, I think the extrapolation for other traumatic brain injuries, if you have the opportunity to treat them, certainly concussion in sport, I think is an area where, you know, potentially if they could look more closely at NAC would be quite beneficial. Other behavioural issues like nail biting, skin picking, etc. Cardiometabolic health, again, non-alcoholic fatty liver disease as a really important antioxidant and anti-inflammatory. Respiratory conditions, as I mentioned, really important there for chronic bronchitis, particularly that can be hard to shift. Modulates the immune system, so any of those immune conditions, sports nutrition, children's respiratory infections, and also fertility as well. So it's been shown to improve some of the underlying, I guess, factors that can impact fertility, like endometriosis and PCOS, as well as recurrent miscarriage as well. So really broad applications. As I mentioned, it is one of my favourites. Dosing wise, I mean, you can certainly use the clinical applications chart as a guide to what dose was used in that particular study, and also as a guide for children's dosing. It's generally 10 to 50 milligrams per kilo of body weight twice a day. Each scoop, so there is a scoop in there, contains 945 milligrams, so just under a gram of NAC per scoop. Your standard dose is 2 grams a day. So 1 gram BD does cover a lot of your applications. As I mentioned, you can use the chart as a guide to dosing for different conditions based on the research. But generally speaking, 1 gram BD is a good therapeutic dose for most applications for adults. And it does have a 12-hour half-life. So supplementing BD can be beneficial. Yeah, but you'll find that chart really interesting. So if you're wanting to go through that in more detail.
You should go on the Megtor Excel. Do you recommend it with any of those powders that we talked of last week?
Absolutely, it could combine with any of those powders. You know, MitoXL for mitochondrial function, and as I mentioned, you know, we talked about MitoXL for helping with PCOS, and the NAC also helps with PCOS, and also the blood sugar regulation. It's also being compared with metformin. And we talked about the inositol, certainly MitoPro, and I'm not sure if you're using that for male fertility, but using it alongside that for male fertility, or for anyone in the sports field, immune system. Yeah, so it combines really well with any of those powders that we talked about last week. Absolutely. And taste-wise, it mixes really well as well, which I think is good to know too.
Right.
So PEA was the next one. And again, we've got a really good chart that, have you got some time to keep going? We've just got a few more to...
Yeah, I'm good.
Okay, great. Yeah, anyway, if there's any questions, you know, I'm more than happy to just set up another little time for anyone that needs to go through anything else. So this PEA is in a powdered form. It's unflavoured and unsweetened, so it has no added excipients at all. It has no taste. It's very neutral tasting, so we didn't feel the need to add any sweeteners or flavouring. You can mix it with water. It does mix better in a shaker, just to kind of mix it nice and easily. Otherwise, it can be just taken straight off the spoon. There is a scoop in there, so obviously you're not wanting to get wet necessarily and put it back in, but it can be just eaten directly and just had with a little bit of water. And I tried that the other day. It's actually quite pleasant. I didn't mind that at all. So it's 300 milligrams of PEA together with 200 milligrams of sunflower lecithin, just to aid dispersion in the stomach and aid absorption. It is a Italian sourced PEA, so the actual PEA is made in Italy, and interestingly there was a scientist in Italy that won a Nobel Prize for their research into PEA. So Italy is really kind of the homeland of PEA research, etc., and they do make the best quality PEA. So they use a sustainably sourced palm oil, so it is a palm oil derived ingredient, and it's certified sustainably sourced, which is important. The PEA is made in in Italy, I beg your pardon, and then the end product. So we source the PEA from Italy, and the product itself is made in Australia. We have this chart that outlines some of the key functions and benefits of PEA, as well as the research. So certainly, anyway, we'll go through the research in a moment, but PEA is an endogenously produced fatty acid amide. So we do actually make PEA, but when we're experiencing chronic pain, our PEA levels do decline. So we can supplement with PEA both acutely but also for chronic pain to help increase our endogenous levels. Its key mechanisms here are that it is an immunomodulator, so it modulates the immune system. It's anti-inflammatory, and it's also analgesic, so particularly beneficial for nerve pain, neuropathic, and also chronic pain. And it does indirectly influence the endocannabinoid system. So its key mechanisms here that explain its anti-inflammatory and anti-analgesic actions are that it does downregulate mast cell degranulation, so it improves the immune response. And then it also directly influences PAR alpha, which modulate PPAR alpha. And so this has an anti-inflammatory effect. So it's directly anti-inflammatory, but then it indirectly influences the CB1 and CB2 receptors. And this is where it has an analgesic effect. It does also work synergistically with a couple of other nutrients. So it works synergistically with omega-3 as well as turmeric, and also resveratrol. So you could consider using co-prescribing PEA alongside certainly omega-3, either curcuma clinical or synergesic. And then if you were co-prescribing it with, we do have resveratrol on its own as well, but you may find the omega-3 and turmeric is sufficient to use in conjunction. But if it was using it alongside MitoXL that we talked about last time, that also contains the resveratrol. It's also a really important ingredient. It's sort of become to light in the last few years, and particularly important addition to our, I guess, repertoire for pain and inflammation, and particularly for chronic pain, because there's so much more of an awareness internationally now around the use of opioids. And doctors are tending to prescribe fewer opioids because of their addictive nature. So having alternatives that can really help to address pain, both acute and chronic pain, I think is really, really important. So as I mentioned, it can be used for a broad, a huge range of different types of pain. It's particularly been shown to be beneficial for neuropathic pain, but likewise carpal tunnel syndrome, chronic back pain, osteoarthritis alongside, say, turmeric, for example. We've had some really good clinical feedback for TMJ as well. So we've had practitioners using it, prescribing it for TMJ, and also sciatica, even as an adjunct therapy for autism as well. And that was used together with the medication or risperidone, and they had a improvement in irritability scores. So very easy to dose, very easy to prescribe. It's unflavoured. Each scoop contains 300 milligrams of PEA. And as you'll see from the chart, the doses really, you can do a loading dose, particularly for chronic pain, chronic back pain, of 2 scoops twice a day or 600 milligrams BD. And then dropping it back to 1 scoop twice a day or 600 milligrams. So for adults, that 600 to 1200 milligrams does appear to be the best therapeutic dose, but starting with a higher dose. You can also use it acutely for acute pain, and it does have a 2-hour half-life. So you can prescribe it every 4 hours in a similar way to how anti-inflammatories would be prescribed for that more acute pain and inflammatory processes. Are you using PEA a lot at the moment?
No, it's new to us.
It's new.
We haven't had a supplier using PEA, and so this is newly available. I'm keen on it. We've got, I don't know, maybe a dozen different chiropractic clinics as part of our group.
Yeah.
So they'll be keen to be, we're actually doing a talk to chiropractors. The date has to be set, but there's one coming up again, and that they were going to do the subject of pain, so it's nice to have a hot product. The two that you've mentioned, the Synergesic, was it Synergesic? Not familiar with the name yet. Synergesic, and this, magnesium like or Excel, just to that, of course you can always do the omega-3. Our chiropractors here tend to be a bit light on getting it with nutrients, and they don't realize they could get a nice supplementary income, but at least there's 4 good things to be teaching them about, and hopefully they'll pick up, some of them will pick it up. So just on that, Louisa, have you used PEA for pains with patients yourself?
I have used it for chronic back pain. And it does take a little while, so it's not always, and the feedback that we've had from other practitioners is that it can work quite quickly, but I think it's worth being aware that it's something that can, particularly for those more chronic conditions, can take a little while. So you can see with some of these, with some of the studies there, the full benefit was achieved after 2 months supplementation. So I think that's sometimes worth just being aware of, but also letting patients know that they may need to do a loading dose of 2 scoops twice a day, and that container will still last them quite a long time. Because it's a 50-gram dose, so that still lasts them a significant amount of time. Doing the BD dosing, doing a loading dose, and giving it a good probably 4 weeks trial, so sticking with it for a good 4 weeks, but the full benefits for somebody that's experiencing chronic pain can take up to 60 days.
Yeah, well, I mean, listening to your half-life of just 2 hours, so, basically after 4 hours, people need another dose. So I think probably the way to go with that acute pain is to do a 3 times a day dose by the sound of it.
Yes.
twice.
Absolutely.
You know,
For acute, acutely, definitely. And I think it's also worth combining it with Synergesic or Curcuma Clinical or something like that.
Yeah.
But there are pain specialists that prescribe it. Previously, before it became available in the Australian market, there were it was only available through compounding pharmacies, and there are pain specialists that have been using PEA for a little while. So good that it's now available.
Yeah, I guess you haven't had the access to CBD that we have here.
No, we're a bit
slow. Do you have any, whether it be synergistic with, or to really choose one or the other?
Yeah, interesting question. Good question too, because there's no contraindications that can be used safely alongside medication. With CBD oil, you probably use one or the other because you will somewhat negate the effects of PEA with the CBD oil. So it's not that there's an adverse interaction or anything, but you just might not get the benefit of the PEA if you're using the CBD oil as well. I mean, it does have the other mechanisms though. As I mentioned, it's only indirectly influencing the CBD receptors, so it's not going to have that effect because the CBD oil will be taking over that action, but it will still reduce inflammation and work on mast cells, etc. So it will work on those mechanisms.
Yeah.
Yeah.
But then your understanding of it is that most of the pain management is through the CBD connection, is it?
The analgesic effect, yes. So the analgesic effect that is on top of any anti-inflammatory benefit is by the CBD receptors.
Okay.
Yeah.
Good.
So Angstioton, there's just a couple more to go through, and Angstioton is one of our, well, it's not purely herbal. We do have a couple of nutrients in there. As the name suggests, it's really designed for anxiety as well as sleep. So really supporting GABA. I mean, herbs do work on a variety of different neurotransmitter receptors, but it contains kava, which has a good dose of kava-lactones, and a very high quality kava that's from Vanuatu, which is where the best kava comes from, that has the best kava chemotype, which is basically ensuring that it hasn't the adverse effects, together with ziziphus and passion flower and magnolia. Ziziphus and magnolia have been shown to be particularly beneficial for people with poor sleep, to improve sleep quality, and also melissa, which is a good nervine herb. A little bit of magnesium and glycine, but certainly the herbs are really have the key actions here. So it can be prescribed throughout the day for anxiety. I have practitioners that prescribe up to 2-3 times a day, which initially, I thought that was quite a high dose, that the passion flower, particularly at that dose, might be a little bit sedating, but it really just depends on what the patient needs. And so I do see this as, I guess, a little bit more of a symptomatic formulation, and so you can dose according to what the patient needs. I usually recommend 2 at night for sleep, and it would combine really well with any of the magnesiums that you're using if you're prescribing them at night. So magnesium and Angstioton together at night to improve sleep initiation and also sleep quality. But likewise, it can be used throughout the day for anxiety as well. If people are feeling stressed and anxious, obviously the different patients are at various different degrees and levels when it comes to that. I just start with 1 at a time. It usually works within about 20 minutes. And it just helps to calm people down, reduce the anxiety, but I think kava is very good at helping to maintain that clarity and focus. So just really reducing that anxiety, reducing that stress level so people can perform better. But I would certainly assess somebody's reaction to these herbs, and during the day, just prescribing 1 at a time. But they can increase the dose as required. If they find it a little bit too sedating, then of course they just need to drop the dose back. But I have had practitioners prescribe up to 2-3 times a day without it being overly sedating for people that have really high levels of anxiety, high levels of stress and anxiety.
just to say it for the folks who didn't hear it, I don't think just yet, was it's mainly a GABA stimulating formula.
Predominantly GABA, yeah.
Yeah,
absolutely, predominantly GABA, yeah.
And the other kind of use that a lot of executives find handy, it's not happening just this year, but generally speaking, there's, you know, regular presentations where they've got to stand up and function well. And it works really great. I actually use a little sip of kava every time before I go and do a presentation, just to make me more chilled out. And it was great. So, you know, it's good for when you've got, if you're anxious before exams as well, would be appropriate.
Absolutely. And I just do one.
Yeah. Just mild doses, or at least in that sleep deprived period before exams. It's pretty handy for that type of uni student and so on.
Help with winding down, help with calming down at night, exactly, because you need to be sleeping well. As you mentioned, absolutely perfect for a pre-exam interview, presentation, etc. You know, I mean, I have my sister-in-law on it. She's not a big supplement taker, but just, you know, she's a teacher, she's got 3 kids, and just when she feels a little bit overwhelmed or stressed and she takes one, and it's, yeah, for somebody that doesn't take a lot of supplements, she really finds it works extremely well for her.
Yeah, now worthwhile me asking, you know, there is the history with kava and about the liver concerns. Perhaps you're best to speak through that on this product.
Absolutely. So that was what I sort of touched on with this kava chemotype. So basically there can be, and what the chemotype is, sorry, I'll just enlarge that a little bit. What the chemotype is basically the ratio of these key constituents. So you have these 1, 2, 3, 4, 5, 6 key constituents in kava, and they can occur in a variety of different ratios, which is called a chemotype. And there are over 200 different kava chemotypes. So what we have sourced is, it's from Vanuatu, and it's a government regulated industry in Vanuatu, and that what they've developed is a chemotype that has the best anxiolytic benefits, but without any liver toxicity, without any other sort of psychoactive effects, without any of the negative effects. Because with, as I mentioned, 200 different chemotypes. So not all kava is the same, depending on where it comes from, depending on how it's grown. It can have different chemical makeup. And this is why, you know, there have been instances where there have been some problems with liver toxicity, etc. So just ensuring that you do have a kava that has the best chemotype, that's going to, you know, be safer and also have a better therapeutic effect. So we've sourced this from Vanuatu, which does have the best kava, and we've also had it third-party tested as well to show the chemical constituent, the chemical makeup, and ensure that it does have the correct chemotype.
Great.
Yeah. So NeuroEnhance. NeuroEnhance is a great formulation. So, and I think we're talking about SFM next. NeuroEnhance for mood, stress, nervous system support. It does work on the serotonin pathway. So it contains saffron with good levels of these active constituents. So the safranol, the crocin, and the picrocin. So good levels of the active constituents. Saffron has been shown to be as effective as SSRI medication. It's also antioxidant. It has anti-inflammatory benefits, reduces neuroinflammation, also helps to reduce cortisol. So it has a lot of broad range of benefits. Also really important to have a high quality source of saffron because it's very expensive, and therefore there can be a lot of adulteration. Together with withania and rhodiola, St. John's wort, so hypericum, and then your key cofactors for neurotransmitters, which is B6, zinc, and also a little bit of vitamin C. So B6 and zinc particularly are 2 of your key cofactors for neurotransmitter production. St. John's wort, of course, increasing serotonin. It's also anxiolytic. Helps to reduce anxiety, as well as being beneficial for mild to moderate depression. You may just want to be a little bit cautious with antidepressant medication with the hypericum. So increasing serotonin, but as you can see here, it also has an adaptogenic component to it as well with withania and rhodiola. So rhodiola also increases serotonin. It has a similar effect to SSRIs. But interestingly, rhodiola also modulates dopamine receptors, and it will also increase dopamine. And we know withania is also an important adaptogen and nervine. So we use the KSM66 patented form of withania, and it's been shown to have the highest percentage of withaniolides of any withania, and it's also made to traditional standards. So with this particular formulation, people feel better quickly. So it's really designed for patients with low mood, but particularly low energy. So again, associated with stress, potentially, HPA axis dysregulation or adrenal fatigue. We know withania has a modulating effect on cortisol. So cortisol is low, it can help to increase cortisol if there's long-term, stress and adrenal depletion. But likewise, in that more of acute stage of stress, withania can help reduce elevated cortisol as well. So certainly a good adaptogenic formula to support mood and mental health, particularly associated with low serotonin and also associated with stress. So I would prescribe this predominantly in the morning or early afternoon because of particularly the rhodiola can be more of a stimulating adaptogen. So we're not necessarily wanting to give this formula at night, but in the morning or lunchtime, early afternoon, just to help lift the mood as well as improve energy and stress levels. So anything from the, patients that you were talking about, Graham, that, have to do presentations. If there's a high level of stress in the corporate world, NeuroEnhance can be great. Likewise, it's been prescribed a lot to young, to mums with young kids running around who are just exhausted and feeling really flat and exhausted. And NeuroEnhance just gives them that pick me up, both from a mood and mental health perspective, but also from an energy and fatigue perspective.
Yeah, okay. Another comment about rhodiola, apart from it being an adaptogen, and you mentioned that it helps with dopamine. It really stimulates the activity of MAOA, yeah, one of the centers in the genetics that helps to break down the compounds called catecholamines, which is like dopamine, adrenaline, noradrenaline. And in the past, there was quite a lot of antidepressants that were called MAOA inhibitors. That was the first class of antidepressants because they help to raise these catecholamines, and that includes adrenaline and noradrenaline, which is partly why this is an adaptogen. But that makes people more alert, basically. So, rhodiola by itself is quite good for exams. And in the formula here, it's adding to not just the serotonin effect, but you've heard of the SSRIs, which is mostly about the serotonin. But then there's this other class of drugs called SNRIs, and the N's for noradrenaline. And effectively, this covers both because the N in SNRI is the one that rhodiola touches on. It's like an MAOA inhibitor. Mm. And I hope that wasn't too technical, but basically what it's saying is this is a much broader activity in the brain than most things. So it's reducing the stress response and really supporting a lot of the neurotransmitters in the brain, to keep people both alert and with a more positive mood.
Exactly. Yeah, absolutely. And it's also, rhodiola is also in our other formula called Pre-Lift for, one of the reasons is for that purpose to inhibit the breakdown, inhibit MAO and inhibit the breakdown of dopamine.
Cool.
And I think that's the beauty of herbs too, is they do work on a number of different neurotransmitter receptors and enzyme activity as well. But yeah, I know you're interested in the patient experience, and patients do feel better very quickly on this formula. And I do find rhodiola works quickly as well. So I think that's, one of the reasons, together with other herbs, and it's a really nice combination.
Yeah.
So SFM, Excel is essentially a formula for hypothyroidism. So for thyroid function, metabolic and nervous system support. Interestingly, SFM kind of, this is a formulator that was originally formulated quite a long time ago by Henry Seki. SFM stands for, sometimes people are interested in what do these names mean, super fat metabolizer or stimulates fat metabolism. So he did formulate it for his weight loss patients. And, you know, as we know, hypothyroidism can contribute to weight gain and an inability to lose weight. So if you're just wondering what the name refers to, so it is a formula predominantly for hypothyroidism to support thyroid hormone production. So dosing wise, generally 2 a day. So whether it's 1 twice a day, or I do have a lot of practitioners that prescribe just 2 tablets once a day in the morning before breakfast. So it says an hour before breakfast, but I always just recommend at least half an hour. I know an hour before breakfast can be a little bit difficult for compliance, but even if it's half an hour before breakfast or 2 hours after breakfast can sometimes be an easier way of taking supplements if they can't manage before breakfast. So between breakfast and lunch could also work. And as I mentioned, 2 once a day, lots of practitioners and patients find works well. Otherwise, 1 twice a day is good too. So tyrosine being a really important precursor for thyroid hormone production. But interestingly, as you mentioned with dopamine, tyrosine is also a precursor amino acid for dopamine production as well. So, and hypothyroidism can sometimes occur secondary to adrenal fatigue. And I don't have the pathway right in front of me right now, but you do have tyrosine that can be converted to thyroid hormones or dopamine, and then norepinephrine, noradrenaline and adrenaline. So there is that connection with dopamine as well as and adrenals as well as thyroid hormones. And for that reason, there are a couple of adaptogenic herbs in here, so withania and rehmannia, just to support the adrenals as well. But your other key nutrients are inositol, which I'll go through in a moment, selenium, zinc, iodine. So all these nutrients that we know are really important for thyroid hormone production, as well as chromium and all of the B vitamins. So at 2 a day, 2 tablets a day, you will get the equivalent of an activated B complex. So you will cover your B vitamins in 2 tablets a day. So I think that's worth just noting. And I think that's also one of the benefits of the products is that you are essentially combining almost 2 products in one. So an activated B complex together with the thyroid nutrients and adrenal support with the herbs. The zinc and iodine we know are really important for thyroid hormone production. Inositol, as I did touch on, I think last week with Mito Excel, inositol has been shown to improve TSH receptor activity. So the study found that 600 milligrams, so the equivalent of 2 tablets a day, actually reduced elevated TSH levels by about 30%. So really improving that TSH receptor activity, which is important for thyroid hormone production. And then the selenium in that same study was shown to reduce thyroid antibodies by 44%. So it's quite, and it was only 83 micrograms, so it wasn't even as much as we have in here. So the selenium was found to be particularly good for reducing autoantibodies, and the inositol for the TSH receptor activity. So quite significant study there. And I do, in Australia anyway, I think we're the only ones, unless anybody's added it in more recent times, to have inositol in our thyroid hormone formula. So it will improve thyroid hormone production, reduce antibodies, improve TSH receptor activity by improving thyroid function. And as we know, there's a lot of subclinical hypothyroidism out there in our patients. But it will also improve mood as well by supporting dopamine levels with the tyrosine and cofactors for dopamine production. And we also need selenium for the tyrosine hydroxylase enzyme as well, for tyrosine being converted through to L-DOPA. So it will help with weight loss, but again, that's really just supporting both that dopamine and thyroid pathway. Certainly improving mood, energy levels, and people do feel better on this one as well. So practitioners who prescribe a lot of this particular formula find that their patients feel better really quickly.
Yeah,
so hypothyroid
looks like a great formula actually. It takes the ones we've been using very nicely. So I'm keen to try it out. I like that good focus on the adrenal factor, which is often relevant. It's often these sort of moderately stressed patients long term or post pregnancies, there's a common onset of hypothyroidism with looking after babies and all the super fine things you have to do. Yeah, so it looks good, and good to hear that patients actually feel better when they start it. That's not always the case. So that's
so I would definitely recommend taking it half an hour before breakfast. So taking it away from food is important. It does have a little bit of nicotinic acid in there, but it's only 5 milligrams or 10 milligrams if they're taking 2. May cause some mild flushing, but just something to be aware of, but it's not problematic at all. It's just, increasing vasodilation. And then the last one that we had to cover today is Progestolift. So Progestolift, as the name suggests, is designed for increasing particularly progesterone production. So it indirectly increases progesterone with Vitex. And we have sourced, so we did upgrade Progestolift about maybe 18 months ago now. And one of the things was that we did increase the amount of Vitex up to 1 gram per capsule. Dosing wise, it's generally 1 capsule a day, but some practitioners do prescribe 2, so they'll do 2 capsules. Sometimes prescribing it 1 a day or through the whole cycle, or just from mid-cycle onwards, particularly for fertility and for ovulation, for stimulating ovulation and for fertility. So you can do either way, both for fertility and also for PMS symptoms, which is predominantly what it's utilised for. We did source a nice boutique supply of Vitex. So this particular Vitex has really good doses of the active constituents and much higher than 2 of the other leading Vitex extracts. So I'm not sure if you were using the Bioceuticals Vitex, but they actually have listed on their label the amount of agnoside or cumin. And if you compare it, this one actually does have twice the amount of those active constituents per 1 gram. And the other thing that's not in a lot of some of the other leading Vitex extracts, or not listed anyway, is the casticin. So casticin is another constituent of the Vitex, and it's been shown to improve a lot of the signs and symptoms of PMS, similar to the other constituents, but it's also been shown to be beneficial for hyperprolactinemia. So having that casticin in there as well is beneficial. It also contains Melissa officinalis, 1.2 grams, which is a great nervine herb, and it has been shown to be beneficial for PMS symptoms. Contains some key ingredients here are the parsley, perilla, and also the quercetin. So parsley and perilla, the parsley contains a flavonoid called epigenin. The perilla contains a flavonoid called luteolin. And so the epigenin, luteolin, together with quercetin, are 3 key flavonoids that actually inhibit the breakdown of progesterone to its inactive form. So it's all about increasing progesterone production with Vitex and inhibiting its breakdown with these key flavonoids, together with Melissa that improves PMS symptoms, and also a good amount of P5P. So the other, I guess, addition that we, change that we made to this formula when we upgraded it recently was increasing the P5P up to 50 milligrams per capsule. So the studies for P5P sit between anywhere between 50 to 300 milligrams of P5P. Most of them are around 50 to 100 milligrams of P5P for PM. This is predominantly for PMS symptoms and improving a broad range of the symptoms associated with PMS, like fluid retention, mood disorders, carbohydrate cravings, etc. So 50 milligrams is still a therapeutic dose according to the research. So between 50 and 100, depending on how many you're prescribing. But at the same time, it's not doubling up too much. So if you are prescribing other supplements with B6 in there, at that 50 milligram dose, if they're getting extra B6 in other supplements, it's not going to be, it shouldn't be problematic. We didn't want to go too much.
Say magnesium powder product for PMS generally.
Yeah.
What's your general one that you go for?
For PMS, I would probably either go for MagGI Restore, just because you have all of the other nutrients in there as well, or MagTor.
Yeah, I was thinking MagTor.
Yeah, MagTor would probably be, the key one, and then otherwise MagGI, depending on what you're after. At the same time, you could, it would combine quite nicely with Mito Excel as well, but I think your number one would be MagTor.
Yeah, I guess Mito Excel if you're looking for pregnancy to turn up.
Yeah. Yeah, and if there are any other underlying issues going on as well, yeah, absolutely. But yeah, MagTor would be your sort of probably go to there, just with a high dose of magnesium and all the Bs, activated Bs as well.
So, Gina, Chris, that PMS is a common symptom with low progesterone, and they need the magnesium along with the B6 as their kind of first go-to nutrients, and then the Vitex and these other herbs are going to be supportive as well. So does this one very often get used alongside of the SFM?
It could be. It's often used alongside, well, it could be used alongside SFM, absolutely. I guess it depends on the patient, but it's often used alongside Estraclear.
Yeah.
So you've got Estraclear to help with the estrogen side of things, and Estraclear is brilliant at anything associated, well, to help with healthy estrogen metabolism, but particularly if there's any, conditions associated with excess estrogen. So sometimes, particularly, I don't know if fertility is a big area in your clinic, but using, there's some key fertility specialists here that use Estraclear for the first half of the cycle and Progestolift in the second half of the cycle. And get really good results. But obviously you can use them, differently depending on the patient.
Okay, interesting, yeah. And do you see them as antagonistic at all to be using at the same time in the second half of the cycle?
At the same time? No, and I know personally that I have done that, and I've used both right through the cycle. So I don't necessarily think they're antagonistic, and particularly because Estraclear has a modulating effect. So it's just helping to improve healthy estrogen metabolism.
Yeah. And wouldn't you go the other way around? I was understanding that the Vitex is working better in the pre-ovulatory half of the month. No?
It's important to stimulate ovulation, but it can also be, I guess with fertility, it's important for implantation.
Mm-hmm. Yeah, I mean, I get that. The progesterone, kind of idea is that it's meant to be the second half, but it's really dependent on the ovulation happening. And my understanding of Vitex is that it's really about creating a good ovulatory effect. Is that your understanding?
It is, yeah. And personally, I've used it I usually use it throughout the whole month.
Yeah. I use the Vitex. Commonly, I'm using a MediHerb like isolated or one herb product of Vitex, but very happy to be using this instead because it's adding in a few extras. But I see this one is a bit more premenstrually organised, so it's better for the whole month effect.
Absolutely, yeah. So it is very particularly good for PMS, so the whole month. But I think what's also nice about it is that it's giving the Vitex, so it's got all those benefits that you're wanting with the Vitex. But as I mentioned, also you know, really targeting the whole pathway. So also addressing enzymes that break down progesterone, so keeping it in the system longer. So the parsley, perilla, and the quercetin inhibiting the enzyme that breaks it down. So I guess they're in that way having, you know, just increasing the effects of their Vitex.
Right, interesting. Yeah, that's good. I hadn't thought about the breakdown side of it. That's good with those flavonoids.
Yeah. Okay. Any other questions at all? That was the last one we were going to go through today, but hopefully you found that.
It's taken 1.5 hours. It's sorry, is it 2.5 hours? It's a big big download. Appreciate you taking so much time to teach us all those. And
it's
absolutely
absolutely
really picked out them.
Yeah, great. Sorry about the technical difficulties earlier and the delay, but we got there in the end, and I'm glad you had the time to, yeah, happy to do it again if there's any more that we need to cover in the future.
Yeah.
We've got your email address, so we'll...
And any questions at all at any time.
Thank you.
Yeah, and Dessim has that, so yeah, feel free to email anytime.
Thank you very much.
Thank you. Enjoy the rest of your day.
Thank you very much. Thank you.
Thanks for your time. Appreciate it very much.
Thank you. Bye.